So my name is Nikolai Podoltsev. I'm the associate professor in the Department of Internal Medicine in the section of Medical Oncology and Hematology at the Yale School of Medicine. And I treat patients with myeloid malignancies, including chronic myeloid leukemia, as well as patients with acute leukemias. The key takeaway points are related to that this formerly failed cancer became a chronic disease with almost normal life expectancy with the use of the tyrosine kinase inhibitors, which became available now about 25 years ago with introduction of imatinib, also known as Gleevec. And this drug since became generic in 2016, which is a major development and important issue, as access to this medication really broadened, and the cost of this medication became significantly lower, allowing its use in many places around the world. So the treatment goal at this time, prevent accelerated blast phase and improve survival. But there is also another goal, relatively new goal, treatment-free remission. So with the first goal, patients continue to take the tyrosine kinase inhibitor, which controls the disease and makes it chronic. And the patient lives a life expectancy which is similar to general population without CML. We consider this operational cure, right? So because the patient has to continue to take the medication. So, but some of the patients may be able to stop the treatment, and disease is not going to come back in about half of those who stopped in appropriate circumstances, which is functional cure. So this treatment-free remission as a goal is especially important for younger patients who otherwise will have to live with the disease and take the medication throughout their lives for a long period of time. Further research is needed in the area of successful tyrosine kinase inhibitor discontinuation because right now, among patients who are diagnosed with this disease in chronic phase, about half of the patients, about 30% of the patients can stop the treatment, and about half of them will have to start the treatment again. I just have to take it back. Half will stop, and about 30% from the, about half of those who stop will be able to stay without the treatment. So certainly a lot of patients will have to continue to take the drug throughout their life to enjoy this near normal life expectancy. So because of unavailability of this discontinuation strategy, successful discontinuation strategy for the majority of patients, we still have work to do, and research is needed to improve the number of patients who can accomplish this treatment-free remission goal. And of course, we want to prevent development of blast phase, which still occurs, and we have to learn how to treat it successfully. This is also another frontier where we continue to investigate, and hopefully we'll have more successes in the years to come. The previous cure was possible with allogeneic stem cell transplant, and the use of this treatment modality decreased significantly after introduction of imatinib and other tyrosine kinase inhibitors. But we're still using this treatment modality for patients who develop accelerated or blast phase of the disease. And so we do not really have the answers for all of the patients, and research has to continue to prevent these phases of the disease, which are very challenging to treat, and their cure is only possible a lot of times with just allogeneic stem cell transplant, which is the most challenging treatment we're offering our patients. So I think we have to highlight the fact that understanding the basic biology of this disease helped us in many ways, and we hope that this type of success may be reproduced in other diseases, but unfortunately it didn't occur yet. So the understanding of the biology helped us to facilitate molecular diagnosis of CML, develop targeted therapies, continue with molecular monitoring after we started the targeted therapies, and when a resistance occurs, if it does, We do know how to understand the resistance in some of the patients and overcome this with adjusting our treatments. So all of this success would not be possible without science behind the CML, our understanding about disease biology.